Hi, my name is Dr. Kewas and I will be doing your cranial nerve examination today. So you came here for an appointment. First I'm going to ask you some really basic questions. As what is your name? So I'm just going to write it down. Could you spell the last name for me, please? Okay, perfect. Great. And also, could you tell me what date it is today and what is the time approximately? Yeah, not precisely on minutes, but just really approximately. Yeah. Good. Okay. So this was just to see if you're orienting and if you're at your senses, basically. Okay, perfect. So seeing that you are, we are going to proceed to the cranial nerve examination itself. Okay, so first we are going to look at the cranial nerve number 1, which by the way is linked with your smell. It's called olfactory cranial nerve. And first, before I start with this, we usually do not really test this every time. So let me just ask you, do you have any head injury lately or in the past even? Okay, I'm just going to write that down. And do you, by any chance, feel that you have an exaggerated smell or sense of taste? Perfect. Great. So, we are going to test it, okay? I have there my 2 essential oils. You will cover one of your nostrils at the first one and then the other nostril when I let you smell the second one. So cover one of your nostrils. It doesn't matter which one. It really doesn't matter. It's up to you. I'm just going to let out all the oil so that we do not make it messy. Okay, I'm just going to let you smell it. And what do you smell? Once more. Okay. Yeah, it's poppy. It's poppy. This was kind of a hard one, wasn't it? Yeah, I'm sorry for that. We will try an easier, more common smell this time, okay? Perfect. I'm just going to grab the other one. Great. We're just going to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Perfect. So now we got all of the drops out of the dropper. I'll let you smell it. What do you think it is? Yes, perfect. That is vanilla, correct. Great, great. So that was there. That seems to be fine. Your cranial nerve number 1 is intact. Great. Now we are going to try. Now we are going to test your eyes. There are actually many cranial nerves in our eyes, so we are going to run really a lot of tests. Okay, perfect. So first off, we are going to try some visual acuity, then color perception, and also visual fields. Okay, we're also going to look at your eyes real close. yeah, a little close up, and that's so that I could see if there is everything all right with your eyes. Okay, yeah, great. So let's start off with the color perception. So I'm going to cover one of your eyes, okay? And I will show you this. What color is it? Yes, it's yellow, perfect. Now the other one. Okay, what color is this? Yellow again, perfect. And can you tell me, are these color the same? Perfect, they are, that is correct. Okay, so now let's try this. What is this color? Red, perfect. And what is this color? Yeah, yellow. That's great. Now, what is this color? Blue, as my gloves, perfect. And what is this color? Green, perfect. So they are obviously different, right? Yeah, perfect. Can you tell me what this color is? It's pink. It's pink, perfect. Perfect. So the color perception seems to be fine. Okay. So now we are going to try the visual acuity test. I'm going to take this Snellen chart. We are going to go through it real fast, okay? So can you tell me what this letter is? Z, perfect. This one. D, perfect. This one. O, great. This one. L, perfect. This one. O again, perfect. This one. P, perfect. This one. D, great. This one. You can't read that anymore. Okay, that's fine. May I ask you, did you wear any glasses or contact lenses? I was supposed to ask this before, but I somehow forgot. Yeah, I thought so. So that's fine, perfect. Great, now we are going to try, this was the visual acuity test. We have the color perception, so now what we are left with is actually visual field. Okay, perfect. So now you are going to look at the bridge of my nose. Right here, perfect. And you are not going to move your eyesight anywhere. Okay, you just look straight here. I'm going to take my hands and put them behind your back, like so. Okay, I'm going to move my fingers till they get into your visual field, and you will tell me when you start seeing them. You can just say yes or I see or anything you basically want, okay? Perfect. So let's start. Great. Perfect. Now here. Good. And there. Perfect. So it seems like your visual fields are intact in all 4 quadrants, okay? So now we are going to try your pupillary response, okay? We will try direct and consensual. Okay, so I'm going to take my light now. And I will cover one of your eyes and look at your pupil, okay? Perfect, and how it reacts. Okay, perfect. And constricts and dilate. Now the other eye. Let me just grab this. Light green. Constricts and dilate. Constricts and dilate. I'm going to make like a barrier between your eyes, and I'm going to shine the light into your right eye, and I will also watch the reaction of your left eye, okay? So I'm going to make the bridge and look, perfect. once more. Perfect. And great, great, perfect. Okay, now I'm going to ask you to look at this pen. Look at the tip of this pen, okay? And keep looking at it. Keep looking at it. I'm going to light the shine from temporal side, and I'm going to look for any opacity, crescent shadow, crescenteric shadow. Perfect. Okay, keep looking here. Okay, perfect. Yes, yes, great. Keep looking at the tip. Perfect. Perfect. Okay. And it seems that the corneal reflection is intact bilaterally. Perfect. Now you are going to look at the tip of my finger, and I'm going to move it, and you keep tracking the movement, okay? Perfect. You keep tracking the movement of the tip of my finger, like so. Perfect. Let's try once more. Good, good, good. Intact in all four quadrants. That is perfect. That is perfect. Thank you. That is great. So what we are going to try now. So now I'm going to look at your eyes from really close distance. I'm going to be visualizing your optic disc and optic cup. Okay? Okay, perfect. Let me just shine the light. Let me just shine the light and look into your eye. Perfect. So it seems that the sclera is white and there is no nystagmus, which basically means that your eyes are running into different directions or different into some directions, and it's not voluntary. Okay, perfect. I'm glad we understood one another. So that's great. I'm just going to write some notes down, okay? So we tried the cranial nerve number 3, 4, and 6. Great. They seem to be intact bilaterally. Convergence also intact bilaterally. Perfect. The optic disc and optic cup were visualized on both eyes. They had clear borders and clearly white in color. Perfect. The sclera were white without any erythema. No erythema. Let me look at the eye if you have any ptosis, non-ptosis. There are nor entropion nor ectropion. That means that your eyelids are falling down into your eye, or that the lashes are turned inwards into the eye. Okay, so nor entropion nor ectropion. Perfect. Let's look at your conjunctiva. I'm going to pull your downer eyelid down and look at the conjunctiva, okay? Perfect. So this one is pink and this one also perfect. That is great. No AV nicking noted and no papilledema. That's great. That's great. So now what we are going to try is again another light test. Okay, I have there this little chart, and there are several 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5. There's 5 shapes actually. I'm going to shine a light into it. Okay, and whenever you see the light, we count. Okay, perfect. So 1, 2, 3, 4, 5. Perfect. What is the shape? What is the shape? Oval. Perfect. So now we are going to 1, 2, 3, 4, 5, 6. Perfect. What is this shape? It's diamond. Perfect. Now let's try it here. 1, 2, 3, 4, 5. Perfect. What is the shape? Yeah, it's triangle. It's triangle upside down. Great. Now this one. 1, 2, 3, 4, 5, 6, 7. Perfect. What was the shape? A normal triangle. Perfect. Now let's try the last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Okay, what is the last shape? Yes, it was somewhat circular. It was, yeah, oval and circular. Now we are going to test your hearing. Okay, so I have this tuning fork. I'm going to ask you, do you find yourself having any troubles with your hearing lately? Okay, no signs of hearing loss from the patient. Okay, perfect. So what we are going to do, I'm going to cover one of your ears. I'm going to cover one of your ears like this, and I'm going to whisper three random words into your ear. Okay, and you will repeat what you hear. Yellow, love, sadness. Okay, yellow, love, and sadness. Perfect. Now the other ear. Coincidence, pink, ring light. Okay, coincidence, pink, and ring light. That was perfect. Now we'll try also the numbers 7, 3, 35. 7, 3, 35. Perfect. Now the other one. 8, 6, 22. 8, 6, 22. Perfect. Okay. So now I'm going to use this tuning fork. Okay. I'm going to belt it. You will tell me when you stop hearing the sound. Okay, great. Tell me when you stop hearing it. Great. Once more. Tell me when you stop hearing it. Now. Perfect. Great. So that's it. So your hearing seems to be normal. We do not even have to look into the ears since you have no problems. Okay, so now let's try one more test. I'm going to randomly show you numbers since I forgot to do that, and you will tell me every time how many fingers are up. Okay, so let's try now. 2, 4, 5, 1, 3, 6, 8, 5, 2, 1, 2, 4, 2, 4, 10. Great, perfect. That was great job. Okay, can you now look at the tip of my pen? Right here. Perfect. Just watch it. Great. And now look into the distance, into the corner of the room. Right there, okay? Now back to the pen. And again, back. Once more. And again, okay. Perfect. Now, focus here. Focus here. The tip of my, okay. And focus. 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 Pay attention. Pay attention, great. Focus. 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 Here. There. Great. Perfect. Focus. Great. Perfect. So that seems to be fine. Your eyes are working great. Okay, so I think that we can already proceed to one last thing, and that is actually your perception of touch. Okay, so I'm going to take this little fluffy ball of, I don't know what, it doesn't matter what it is. Well, I'm going to take this and I'm going to touch your face with it. You are going to close your eyes. You are going to close your eyes. And I'm going to touch you with that, okay? Perfect. Right there. And you tell me when you can feel it, okay? You say, yeah. Whatever you want. Or 33, 99, whatever you want. 99. 99. And you are going to tell me the location where I'm touching you, whether it is forehead, cheek, left, right, chin, whatever. Forehead, right cheek, left cheek, chin, tip of the nose again, tip of the nose again. Yeah, cheek. Cheek. Yes. Yes. Temple. Temple. Great, perfect. I'm going to touch you really quickly, and you will just tell, yeah, okay? So let's do this. Perfect. really quickly touch you. And you just keep saying yeah. Good. Great. Great. Did you feel it all over your face? Yeah, is it tickling? I'm sorry for that. Great. Perfect. Now we are going to do one last thing, and it is actually I'm going to be touching you with my bare hands. I'm going to take this down. I'm sorry for the plaster that I have on my hand. It's cute and it's for children. That's because I cut my hand with tin. Yeah, I think so. Like can, you know, tin can, tin. I don't know. It doesn't matter. I'm actually from a foreign country, so sorry if my English isn't perfect all the time. Yeah, perfect. Okay, so I'm going to touch you with this pointy and sharp part of this, and I'm going to touch you with my finger, okay? Okay, so let's do this, and you tell me sharp when you feel sharp, and you tell me dull or soft, whatever you want when I touch you with my finger, okay? So let's do this. Great. Yes. 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 Good. Good. Okay, sharp, dull, sharp. Perfect. Yes, sharp, dull, sharp, dull. Dull, dull. Sharp, sharp, sharp. Dull, dull, sharp. Perfect. So it seems like that is fine. Okay, perfect. So your cranial nerve seems to be intact, everything seems to be fine, and hopefully you enjoyed our little session today. This is going to be it. We tested all that we needed, and hopefully you do not have any problems in the future with your cranial nerves. If you do, definitely come by again. I will be here all the time. Okay, so thank you very much, and see you another time. Bye. Yeah, sure. Yeah, the doors are right there. Okay, yeah, just turn to the left. Yeah, and then to the right. Perfect. Hey Jan, can you send another person in? Perfect. Thank you.